we no longer have any signs of infection, which is fabulous. This cat will never father children.
We got bunny, 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 poo, poo, poos.
We are headed off to the auction. Big Red's hooked up. One medical team person is coming this time.
What if it's like holding his hoof together?
50-50 chance right now.
Little renegade, huh?
He was going right for the road. He went all the way up the driveway.
We are going to the Big Lick protest, and this is our Big Lick. They look intimidating.
Okay, let go. Excuse me. That is the weirdest thing I've ever seen.
So that looks pretty suspicious that could be besides a gestational sac. Oh.
What's the wrap covering up?
Oh, it looks so bad under there.
Oh my goodness.
Oh, shoot.
All right, girl. This mare's name is Dove. She sustained a pretty significant hind limb injury, but it's granulated in really well. So we're evaluating today to see if we can change her treatment protocol and leave the bandage off and get some sunshine and oxygen on that wound. We're also evaluating whether or not she can have some turnout time, which I think she would really appreciate. It really looks wonderful.
Yeah.
It's fully granulated in. What she needs is going to depend on her behavior. If she does not immediately lay down and coat that wound in mud, then I think she could be turned out. And I think, rain wouldn't be super detrimental, but if she immediately covers that in dirt, we're going to have to reevaluate. We're gonna try to do this standing today instead of general anesthesia. So the upper right fourth premolar is completely missing. Perfect rectangular hole from the oral cavity into the sinuses. And the dental epoxy that we placed 2 weeks ago held for, sounds like about 4 days, which was great. But the whole space wasn't plugged. And so it was under pressure and it gave away. We're happy because there's no evidence of infection. So all of the smell and the flies and the gross stuff is resolving and the hole is closing in. But today we're gonna try a new product that I've used to repair tusks, which are teeth. And we're gonna try to fill in that hole a little bit more completely. But it's gonna be difficult because the epoxy only dries in a dry environment and we're inside a horse's face and mouth. So Jason has this really nice scope camera that's gonna let us see whether or not the site is fully prepped. So most of what we're gonna be doing is cleaning the area out and getting it ready. The epoxy is gonna take 30 total seconds and then I have to press it in place with my fingers. We'll pack the hole and we'll see how it goes. Important to note, from the very onset, we knew this was gonna take multiple repeated treatments. So this isn't treatment failure, this was an anticipated course of action and we are making progress, which we're happy about. Still not totally in the clear, but making progress. Yeah, the margins of the pocket are way smaller, which is lovely. Yeah, you just love Jenna.
She loves Owen.
You love Owen. We're getting close to having the hole flushed out. I can see it. We are hopefully, putting this dental speculum on her to open her mouth. Now that we have everything clean from the outside, we're gonna take a look from the inside. I'm gonna need, come right up here, Casey. I'm gonna need you to push when I say so. Mm-hmm. Okay, pulse, go. Pulse, pulse, yeah. Push, 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 yeah. Good. Okay, you wanna spray? Perfect. I'm gonna put my finger up here. Yes. Yes, I got it. Have it on the other end. Okay, leave that there. And we're gonna wanna back it up 1 inch. Okay, back it up just a little bit. Like an inch. Yes, Wow, somehow we pushed more food up into this space. Let's get...
Yeah, some was coming out the top.
Great, let's get our big guy and flush a couple more times, and I'm gonna get the epoxy ready. You are going to put this on your finger. Do you not want this job? It's an important job, okay? Your job is to keep the epoxy from going up into the oral cavity. So put this on your finger, find the space where the flush went into, and your job is to just plug it. I don't need you to do it quite yet. I have to dry this first. She says, I'm visualizing biting you right now. I am going to hand you this. It will drip. If you get it on anything, it won't come off. So your job is to cover the tip and just hold it. Okay. It'll ooze out just a tiny bit more. I'm gonna wait to pump this until you're fully in position. Just keep your finger there. You got it. I'm not gonna push it in with that much force. We're in place, pressing. Firmed up way too fast. Look at that. Look how fast it firmed up. The challenge is I envisioned applying this through the hole, because 2 weeks ago the hole was wide open and I could have just put the epoxy gun straight down into the hole from the outside, but it's way smaller now. So if I can't access it from here, we don't have an option. Ooh, Casey, I'm so sorry. I'm so sorry. Are you okay?
I had gauze, it's okay.
It's in. Yay, okay, hole is closed. You giving me lots of pressure from that side? Ooh, it's warm. It is warm. Jason, I am ready to verify if you wanna. Okay, so the epoxy is white. See it right there? I made a little bit of a mess, but you can see our broken tooth is right there. See how it's nice and smooth right there? And all of this is extra, but what's important is that is flush with that tooth, so there's no pocket anymore. And this is probably gonna wear off as she chews. It probably isn't gonna taste great, but. Do you want me to try to throw one in and just see?
Yeah, just because I don't want to save it, you know.
I think we can save the suture if we need to. Hi, ma'am, hi. We just wrapped up repeating the treatment on Halo, and it was technically challenging because the hole had closed down so much from when I worked on it 2 weeks ago that the angle that we needed to, previously I had a straight shot down in, and today, both from the inside of the mouth and the outside, we had a really challenging angle, but it was great. Our team worked really well together, and we were able to get it flushed from the inside while monitoring from the outside and vice versa. And then fingers crossed, I feel really good about this epoxy application. 2 weeks ago, we only had enough epoxy to plug about a quarter of the hole, and today we got the entire hole filled. Jenna held pressure from the inside to make sure that the epoxy didn't escape up until those nasal cavities, and we no longer have any signs of infection, which is fabulous. So Halo's trying really hard to put down new healthy tissue, and her prognosis is still guarded, but I'm way more optimistic today than I have been up until this point. Okay, I've run out of available hands. Halo, you did great.
We're gonna head this way. I'm Kimberly, I'm the adoption specialist.
Well, that's Porthos and Panda over there.
Okay.
You go take a look at him?
Yep.
All right. He might be your best bet then once you get him started.
That's what I want.
Because he's still a little more fearful than he is. Yeah. He came from...
Sulphur, Utah.
Utah, yeah.
Yeah.
Feet looks pretty good too.
Yeah, we were able to get the farrier to work on them.
It's like he's fine when he's not around a bunch of people.
Yeah, the guy that hauled him in, he said, they're crazy, they're gonna kill somebody out here. I was telling him, you know, like, we're just gonna take care of them, we'll see what we can do with them. And like, probably be about 6 months to a year before you get the saddle pad up or their back. Took me 2 days.
Yeah, I want him.
All right, he's taking Panda.
Good deal, all right.
Well, I was just looking for a horse to adopt to train up for cowboy mounted shooting. And I heard from a friend about this place. And she sent me actually a picture of Panda, and it's a BLM Mustang, and I've always wanted one, and I know plenty of people who have them, and they make really good horses. So I just decided to put in my application to adopt him, and it got approved, so here I am. It was a really great.
Nice place.
Nice facility, and really good staff.
Really impressed.
We're fixing to neuter him.
We are just gonna quickly neuter one of our barn cats today. This is antibiotic eye ointment, but it has a little bit of lubrication in it. We're done. This cat will never father children.
He's doing great. We got blood for his FELV FIV test. He got vaccinated. He got castrated today. Microchipped, and once he wakes up, he is ready to be a wonderful member of society in somebody's home.
We got bunny, 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 poo, poo, poos.
Oh, we got feet coming out the bottom, guys. There we go. As long as one ain't crawling out, we're good. Sorry, I'll try this.
1.8.
Yeah.
He says, where are the carrots?
They didn't have any carrots, just apples.
No carrots. Oh my goodness, I don't even know I like a carrot yet. I don't even know I like carrots. Oh, look at that.
This is Ender, and we are about to do a dental on him.
Casey, come listen to this. It's a sucking sound at the end of the dub beat. So the lub dub should be a crisp two sounds. Mm-hmm. This one goes lub, and the dub is like a swoosh afterwards. If one of the valves isn't closing crisply enough and you get a swoosh of backflow into the area where it came from, then the heart has to overwork, because then it's pumping the same blood back out over and over again. This contraption lets you get a lot done. He doesn't have a lot, but he's got some sharp hooks on the top.
You pulled top and down iris, right?
Oh man, teeth, but they're better. All right, all right.
He did pretty good, considering, he's really nervous. Having a power tool in your mouth can be kind of scary. But he did really well. He did have some sharp points, but we got those taken care of. He came from our last auction pretty emaciated. So as you can see, he still is, but he has put on 75 pounds since he's been here. So we're hoping the teeth float's gonna help that. All right, what's the plan?
So we're gonna sedate the donkey and take some radiographs of the feet just to see what the shape of the coffin bones are in. Strangely enough, donkeys are actually a lot easier to rehabilitate their feet if there is rotation than it is horses. I'm not sure why, I'll have to ask Kayla next time, but I know this donkey's been laying down a lot since it came in, so we're just gonna see what it looks like on the inside.
Oh yeah, beautiful, beautiful.
All right, we got it.
If you correct, yes, that's what we need, right there. That should be a lateral. I will try to hold it. There we go.
What?
Gas.
What's happening?
Okay, so there's really not fixing
No,
this.
I would put this to sleep. There's gas. There's a gas tract here communicating all the way, and look at the severity of the coffin bone remodeling.
Ah,
Sorry, Bubs.
Sad day, little baby.
You're super cute, hee-haw.
How many animals do you think we're gonna get tonight?
I'm gonna say 35.
50 as always.
50 as always. Okay. Good guess.
Oh, I don't know even what. I'm gonna go with 28.
We are headed off to the auction. Big Red's hooked up, and got our medical. One medical team person is coming this time, and we have no idea what we're going to encounter. Last auction rescue is pretty rough. Hopefully this one's better.
It'd be nice because, you know, like Tony was saying, the last auction rescue it brought a lot of tears, it brought a lot of sadness. And there was actually a horse that we had to put down at the auction. It was in too much pain to travel, so.
We had to have a vet come in, like, you know, do it there. It was rough. Well, it looks like Keith has got our rig hooked up for us.
Well, it's time to go then.
He's been busy. He hooked up Big Red and he's hooked up ours, and it's time to go.
Somebody very sweet donated a bunch of apples, so Keith is loading them up into the trailer so we can give everybody some fresh apples for a nice little treat, especially after all the stress of the auction.
3, 5, 6, 8. Like 8 or 9 bags of apples in there.
Hey, we're all loaded up and heading out to auction. Can't wait to get there and see how many horses we get. Thank you so much for your support.
All right, Tanner, what's the issue here?
Well, the first issue that we're just gonna start with is because Angela and Keith, Tawny and Jason have left for auction. So that puts me in charge. And when I'm in charge, something always happens, okay? So Corey was under the weather, went home early. So thank God we have Owen here. I just got him off the tractor to tell him. John came to me and told me that the bathroom was overflowing, and I thought it was a practical joke. Because John's got a funny little sense of humor, right? He wasn't lying. The bathroom has water coming out, not from the pipe, but actually underneath the wall. Now our walls, as you can see, are the paneling. So we're trying to figure out where the leak is coming from. And on the other side, it is coming out all underneath the wall here. And then this started getting wet and coming out and getting the boxes wet. And we are gonna try to see which that part looks like it's dry. It's just a spot of water. The worst area is in here. So our bathroom area.
Before Sarah trips and falls over a halter that's laying on the ground.
Or the trash can. So, thank you for walking with us and Sarah. Is here. So we're trying to figure out where the leak is coming from and get it stopped and make sure that if we have to turn off the water, that we can do that.
Okay, Owen's got the drill here.
That's a scary thought.
Might need to cut into the wall, maybe?
I hope not. What we may have to do is just break the foam on the backside.
Owen took the panel off of the wall and checked the storage room side, and it looks okay. Looks like the actual drain for the sink side that is in the bathroom is what was leaking. So we're saying that we can still use the restroom, the bathroom, the toilet, but you cannot wash your hands. Owen would like to make a PSA that you can still wash your hands, please, in the other bathroom for now.
We've just arrived at the auction, and we're gonna go take our first look at the horses that need rescuing tonight. Hey everybody, so it's getting crazy late. It's already 11:30 at night. The auction has just ended. We've just paid for them, and we saved 24 amazing horses. And that is literally thanks only to your support, because we couldn't do it ourselves.
There's a song in my heart, there's a fire in my head, smoking out the truth.
Keith is gonna get this horse out so that we can find out the mystery under the bandage.
Okay.
Because there's too many horses in there to really like take a look and not distract him, so, and do it safely.
No, come on. I know you don't want to walk. Come on.
Yep, I'm gonna put some gloves on. I don't know if I would be touching that.
There's a big chunk of hoof missing out here too.
Yeah, that's what I'm thinking. I'm like thinking this is not great. I don't know if I want to take this off. What if it's like holding his hoof together?
That's what I'm worried about. It's a 50-50 chance right now. I mean, there's a lot of stuff oozing out of that.
I think if he'll let me, we should just take it off. If he doesn't, you know, I can stop, but because he already has pain meds on board and he still doesn't want to put any weight. Oh gosh.
Oh my gosh. What is this?
That looks like a giant abscess.
Yeah. Yep.
It is.
I mean, it looks like it's all
really
totally dead tissue at this point. I'm just gonna have to hose it out. Pour like an entire bottle of iodine on it and rewrap it.
Yeah.
I think that it could have just been an abscess, which could have happened from numerous things. A rock maybe stuck up in there or anything, but whatever happened was not touched again, and it was just put over, covered up, let go, and that's what happened here.
Oh, mysterious way, we give and we take, holding it back, all we want to say.
There are multiple either blown abscesses, there's at least 4 or 5 holes, and there's a huge crack in the wall. You can see straight through the hoof. The shoe is literally holding the hoof together at this point. There's maggots crawling in, which was my biggest fear, and it's there. So we're getting it cleaned out. I'm gonna get it wrapped, hopefully we can get it covered, dried, put some iodine in it, try to kill any bacteria, and then we'll assess it tomorrow.
There's a fork in the road when we are alone. Takes distance to know what's leading you home. There's a peace in your eyes. I know we're alright. Oh, mysterious.
So tonight at auction, it was very busy. We initially thought that there was going to be about 78 horses, and when we were in the actual auction, it seemed like the numbers kept growing, so I wouldn't have been surprised if there was at least 100 horses here. I'm glad we were able to save the horses that we did. Unfortunately, we can't save them all. I wish we could, but other than that, we had a successful night.
Everybody have their keys. Everybody ready to go to bed.
Yes.
The girls aren't. They might have been sleeping already.
I left my Sprite.
You left your Sprite?
Yeah.
At the auction?
I did.
Oh.
I'll have to get it in the morning, throw it away.
That's very nice of you.
No littering.
Good night, everyone.
We are here, ready to get everybody ready to head back to the shelter. It's always a relief, the auction morning, because going into the auction is very stressful. We don't know how many we're going to be able to save. And now it's like, okay, we know what our job is, we know what our mission is, and let's get these horses back to the shelter, and that's what we're going to do this morning.
The apples were donated.
Nice.
I'm not sure what
the lady's name was, but I've got like 9 bags of apples here for all the horses today.
Ah, there you go, baby. So this horse is blind, but she's doing really well.
We are going through and just identifying everybody, trying to find their numbers so that we can have all, like, our whole group together before we start assessing. Quit picking on them.
450, yeah. 496.
496?
Yes.
Which one's that?
That one right there.
Oh, okay.
Go, go.
How did that even happen?
I need a halter. I don't know, I just need one. I need something.
I don't know if we have any in the truck.
Wait. No, 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 no. Not happy with me right now. Run!
Oh my goodness.
It's like the merry-go-round, but the not fun version.
Hey, buddy.
Can you just slip it over his face? Make it nice and big so it's not so scary.
Hey, buddy.
All right, sort of got him.
Little renegade, huh?
Oh my gosh. He was going right for the road. He went all the way up the driveway.
So did he just escape? Or?
Yeah, the one, I thought I had shut all the pens over this side, and one just flopped open and out, he came out these doors.
Well, good job
here.
catching him with your bare hands.
What's a day working at a rescue when you're not chasing a mini down a driveway at 7:30 in the morning? So our last horse was a little stud pony, and when we went through and closed all of our gates, he squeezed through another gate and went straight out to the driveway. He went all the way around the building, all the way up to like the front of the auction property. And I hopped in my car. Good thing I drove my car, because I hopped in and sped around to the front. And I was able to stop him and turn him around to get him to come back. So once we got him to come back, he stopped. He's a stud, so he stopped to smell some poop. That's very typical. And while he was doing that, I took advantage and grabbed him by the mane and by the nose, and then we had someone come and bring a rope to restrain him, and then we got him back in, and it's all fine. But I'm really sweaty already, so it's gonna be, yeah, great morning.
When we rescue a stallion, it's always challenging because we have to find other equines that he can ride with. And so far, I think we're doing good. We've got him in with 2 mules that really don't want anything to do with him, and another pony gelding. So I think they'll be able to all ride back to the shelter together without being too crazy. If there was a girl in there, it would be a nightmare.
Doing good. Yes, you are.
Supposedly he was stepped on as a baby. So it doesn't look too bad from this side, but you can kind of look up by his shoulder. He's got a bulge.
So this guy seems like he's maybe newly blind. He kind of walks with a head tilt, just like he's really unsure. He did run into a gate back there, but he's really sweet.
From the last auction to this auction, there is grass everywhere. Horses that have been raced, they will have a tattoo in their lip like she does. So most likely her life has been a racehorse until she got an injury. She couldn't race anymore, and then she was a broodmare, most likely. Could be totally wrong, but that's my guess.
Looks like 8, B, C, 1, 3.
So 18. Here's some apple.
So yeah, he's about 18 years old.
Want some apple?
So,
You know what the apple is?
18 years old.
He's like, I don't know. Yummy.
Yummy. Can't imagine the amount of pain that this horse is in. You can just see pus and infection oozing out of that. Well, he's also very skinny. I mean, he hasn't been eating well recently. You can tell at one point he was probably an Amish workhorse or something, and then he got this horrible abscess that just took him away. But he still has weight on his top line, but it's just underneath he's very sucked in, so he's probably dehydrated and his entire leg is swollen. That wraps up the assessment we do at the auction, and now we got to get them all loaded up and back to the shelter.
Some people think it's a good idea to put the sawdust at the front of the overhead. Those people are not here to get it out of the front of the overhead. I am. Yep. We're all loaded up and we're about to hit the road. We do have another transporter coming, but surprise, we actually rescued 25 horses. So there's a small clerical error inside the office, and when they printed our receipt, they didn't have all the horses on it. So we actually rescued 25, which is just absolutely amazing. But that does mean we need to pay somebody else to haul some horses out to the shelter for us, and they'll be coming pretty soon, loading up and heading to the shelter.
We are up in quarantine. The first trailer just arrived from the auction, and we are ready to start intake.
We made it back safely, and we're just unloading the horses, and everything's going great.
And we just unloaded the first trailer. This is our first horse in the chute, and it's going.
It's going okay. Wish I could be up there helping them push horses, but I'm just glad I get to be a part of this and help out in some way. Been feeling a little useless the past few days, but I guess sled duty will do that to you.
Connie drove up here from Columbia and I slept, and so I'm feeling a whole lot better.
Wild minis.
Supposed to put them in here.
Wild minis, have it all.
Calm down, my duty.
This is a vaccine.
And this is a microchip scanner. We're going to see if she's already got a microchip. And there's no microchip.
All right, what's our...
495.
You're like, I'm done.
So this is fluorescein stain to see if there's a corneal ulcer. Oh, you gotta open up, babes. And if their nasolacrimal duct, which goes from here all the way down, is patent, The neon will also come out the nose. Well, it for sure does. It's got a crazy amount of, it looks like somebody took sandpaper and took it across her cornea. So, can you see this with your camera? All the stain uptake in the green where it's still in the eye. So if there is no abrasions on the cornea, there'll be no stain uptake, but she does have quite a bit of stain uptake, which means it looks like the whole top layer of her cornea is abrased. So we can give her antibacterial eye medications. We just have to make sure we give her no steroids in the eye, or it can actually rupture the eye if there's an ulcer. Yeah, if she has any, it's extremely limited. The other side's completely gone, but very sweet and trusting. What do you?
Move your hand. So this is a little pony we got that came with the Palomino mare. We were told that it was the Palomino mare's seeing eye pony because she's blind. So they do appear to be bonded, so we're gonna try and keep them together. She already had some issues going on in the front with big knees, but she's looking a lot worse right now. We did just give her some pain meds, but we're gonna have our vets take a look at her when they get here.
Quarter horse. He looks quartered in the head.
Yeah.
Sounds great until proven otherwise.
I think though that we did look in his mouth and he was not like super young, but I'll let you look again, but he did not like Tawny touching his mouth.
He looks very
got
tense
all
in the lips.
squealy.
He looks very tense in the lips.
See what I mean? It's weird.
6.
Okay, let go. Excuse me. I was like trying to sip it like a straw. I like ripped the paper off of it. Let's see if you like the dewormer. Do you want this one too? Do you want to sip it? Thank you. What about this one? Do you want this one too? Yeah. Thank you.
$4.90.
What the heck? That is the weirdest thing I've ever seen. Hi, Doc.
What's up?
Can we take that wrap off and look
There you go,
at
Sally.
it?
You want to hold it?
What's the wrap covering up?
Oh, it looks so bad under there.
We need a lot of perishable candy, not
Okay, if I cut you by any food, make sure I don't use this knife. Don't let me cut pizza. He's walking like there's not a connection, a bony connection or ligaments. He's walking like all the ligaments are gone from the leg to the foot.
You want to take an x-ray?
Yeah, let's get an x-ray and see how bad it is. But I've got a feeling that the coffin bone is gone and maybe it may go up to P2 or 3.
How old is he?
Oh, infection's going up the leg too.
Oh my goodness. Hi, bud. Oh my goodness.
It's just hot. I'll start smiling a lot more when it cools down.
And this horse had Banamine this morning. His heart rate's in the 70s. What's really heartbreaking about this is this probably started out as just a regular abscess and just didn't get the care that it needed. The first thing that stood out to me about this horse was his body. And I told Doc he almost looks like a cow because he's compensating so much and for so long that all of his musculature has changed because he's holding all of his weight on those other 3 legs, which is just really sad.
I am getting the x-ray set up to do rads on this Belgian. It's pretty bad, so we're gonna just kind of see what's going on inside, but it's not looking good. Oh shoot!
Oh my goodness!
Oh
Gone.
shoot!
The coffin bone is completely eroded.
Oh my
Like,
gosh!
it's completely gone. It's gone.
There's nothing.
So that takes
P2
like
is
that's
involved.
years.
Oh
That is
my God! There is
years
no coffin
for that
bone.
bone.
I have never seen it. He doesn't have a coffin bone.
You're so sweet and cooperative, sir. Yeah, it's just absent.
Oh my!
I think it's because the infection was so severe that the body resorbed the bone, or it could have fallen out. It's possible that it just prolapsed. So this horse definitely, there's absolutely nothing.
Nothing we can do for you,
I
buddy.
know. So this is really, really severe pathology. The coffin bone should be present below this bone right here and kind of in line with the foot. And it's, you can see little fringes of pieces of kind of moth-eaten looking bone. This infection was so severe and tracks all the way up there that the bone basically crumbled and either fell out through the bottom of the foot or was resorbed. So it takes an incredibly long time for that to happen.
This is one of the most crazy cases I've ever seen. He's literally missing his coffin bone, and there's nothing that we can do for him. So we're gonna say goodbye to him. It's really just heartbreaking. I wish things could have been different, but sadly, there is nothing we can do. And it's just crazy that he suffered that long. Like his bone either was dissolved or literally fell out of his foot.
So this poor horse is about 22 years old. He has almost absent gut sounds in his upper quadrants, which indicates that his large intestine isn't moving appropriately. And he's got some elevated lung sounds just on one side, probably more related to something like fibrosis in the lung than an active infection. His heart rate is in the upper 60s, so upper end of normal is about 44, and that's even with pain medication. So heart rate is one of those things that we use to assess pain. If you can see his lips are also really tense, that can be another indicator of pain in horses. And then if you look at the color of the sclera on the eye, you can see just a little bit of a yellow tint. That is called icterus, and it's one of the hallmark indicators of liver disease in animals. So unfortunately, this poor horse has a lot going on. He also has a really severe angular limb deformity of both carpi, but more significantly this left carpus where his leg is kind of bowed forwards like that. So that's probably a source of a lot of that discomfort. So unfortunately, I think probably needs to have the last act of kindness.
Sure. Too bad. We don't get a lot of champagne-colored horses at the shelter. Giving a horse the last act of kindness or euthanasia, it's basically like turning off the pain switch. And it's in our power to leave the pain switch turned on or just turn it off and let the horse be at peace.
So this horse's abnormalities up here are consistent with kind of a crush type injury. I guess there's maybe a history that he was stepped on as a foal. He's still very young. This aspect right here is very hard. So it feels like a large bony proliferation formed probably to stabilize a fracture. His lung fields, interestingly, are a little further back than they should be. So I haven't finished a sculpting, but there's a chance that there might be a diaphragmatic hernia or something like that involved that may have resulted from, you know, shoving contents of the thorax back towards the abdomen, but I'll keep listening. I'm not feeling any indications of pain, which is great on palpation so far. And he gets an A+ in the adorable department.
Hello, baby. Oh, baby.
Wow.
Can you grab the...
Thank you.
You know what's what?
Nice.
Would you look at that?
Wow, we actually have plates this time.
Bam.
We got a donation for pizza this auction, and we have a special message for Karen and Carol. Thank you so much for the pizza. We get super hungry during auction. Just filling our tummies just helps everything. So thank you so much.
He's getting gelded, and it will really help his entire outlook on life. He just had a sedation, so hopefully he calms down a little bit.
Casey, what are you doing?
I am doing his intake while he is sedated.
We try to do everything we can. Vaccines for a stallion while they're getting gelded.
So this pony has a mass on his back. I'm just documenting mass size in a very imperfect sense because I'm using my fingers, which hopefully won't change too much in size. And then I'm gonna stick a needle in and just see if we get anything. It could be an old scar, it could be a fatty tumor, or it could be an abscess.
That looks like an abscess.
It does look like an abscess. You want to stab that? Let me prep it for you real fast.
It's a bloody proposition everywhere on camera. So, little guy just got gelded. It was kind of a bloody proposition of stuff that happened because then he had an abscess on his rump that ended up being opened up and there was pus coming out everywhere, and so he had a lot going on, and hopefully now he can wake up and start a new life as a gelded.
He's got some lung crackles. He has no incisors, and he's got both of the arcades in the back, not even like flat teeth, like just no teeth at all. We just have gums. With not the worst body condition score in the world is missing 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, close to 12 teeth. We have no upper incisors. We're missing all of our premolars on the upper right, all of our premolars on the upper left, and some of our molars on the lower left.
How's he eating?
It's really phenomenal that he looks this great. His heart sounds good. I'm a little worried he's got some ventral edema.
I saw that. And he's still got those two.
He's got some ventral edema. He is also intact. My other concern is his right front leg. He's clinically lame on, and he does have a lot of tendon sheath effusion and also some evidence of DSLD. This is a little bit dropped. Oh no, oh gosh. Jenna, where's Jenna?
Oh, that's more.
Jenna, this is gonna make you feel better about the conversation that we're having. So all of this irregular proliferative bone right here is very severe arthritis. And then this bone right here has a lot of darker area, so that's also not normal. Horses don't classically get osteoporosis like an older person, but we definitely have loss of bone density here and loss of joint space here. Just a lot of really severe arthritis. I think that's a mark on the x-ray. Yeah. So normally we see pathology down here. This part of this horse's feet look great. His arthritis is a little bit higher up. We are going to do a rectal ultrasound and pregnancy check this mare. She came in and is very bonded to an intact stallion, so there's a chance that she could be bred, and we just want to confirm. These things are workhorses. We got this from one of my mentors from vet school. We really lucked out. This is like the Toyota Camry of ultrasounds. They just, I mean, they're not fancy, but they just keep working. She says, you introduced yourself to me like 3 seconds ago. And she is pretty empty. She's like stealing the ultrasound probe from under my hand and squeezing it back.
Oh, what's that right there?
It's right over uterus. Let's see if I can get a better image of contents. So that looks pretty suspicious for
it really does.
the gestational sac. Can you guys see that? We have a sack. We don't have contents of a sack yet. I mean, there's nothing else in that location that could be besides a gestational sack. Oh, we did not see a baby, but we do see a gestational sac. Likely pregnant. And the uterus has a lot of laxity.
Less than 60 days, and it looks healthy.
Is your bun in that oven? It is amazing that he is able to take bites of grass with no upper incisors. He's just functionally using his gums.
Look at you! Really? This whole 10-acre pasture of grass. It's what they want.
Oh, it's gonna be the cutest baby.
Oh, look at him. He's like, oh, there is grass. Wow.
So we're just turning these two out. They're gonna be out here for the weekend. Really sad turn of events is we thought he was much younger. He's nearly 30 years old and he's suffering from arthritis. The mare's pregnant is what it looks like from the ultrasound machine. So we're gonna let them have the weekend out here together and then we're going to reevaluate again. But it looks like the stallion is gonna need the last act of kindness. With his medical problems, he does need the last act of kindness, but we're gonna let them just hang out and enjoy being together in this beautiful pasture for several days. So be happy horses. We rescued more horses at auction than we thought we were going to. So it's a total of 25. And there are horses still en route to come here at 9 o'clock tonight. So we didn't get everybody done, but we got everybody that desperately needed to get done taken care of today.
We did. We had, 3 of them got the last act of kindness. They were in pretty bad shape. I think we covered that. We'll cover that during the meat of the thing.
I mean, maybe Dr. Lydia, you can talk about the horrificness of just that coffin bone not being there.
Ooh.
Yeah, it's pretty horrible. I was kind of hoping that it was just soft tissue because we got pictures of that horse, Doc and I did, before they arrived, but that has been going on for years for that severity of bone reactivity and loss, unfortunately.
So that was very difficult. But everybody else here, other than the other 2 that needed euthanasia, were suffering from arthritis and in a long time. Mm-hmm. But we're just thankful that we have such a great team here. We're getting done early, which is awesome, but you know, there's more. There's still more that need to be done. But that will be for another day, and we'll get some rest, and they'll all get some rest, and then we'll be at it again tomorrow.
Now try. Try it.
No.
Do it.
No.
Ah! Wow, would you look at that? Somebody doesn't know how to drive anything on this property. Get out of the driver's seat. What are you doing, you peasant? This is our vet tech.
Oh my goodness. What happened to you?
Well, I made it through the auction, and I was getting my little chihuahuas ready for me to come to work, and I was shutting the door, and somehow the door like collided with my toe, my big toe, and so if your toenail's sitting here, it's supposed to be connected to your toe. Now it's just hovering there, floating, and it's extremely painful. So I'm glad I made it through the auction, but I'm supposed to go protesting today, and it's going to be rough. And I did not put my boots on today because there was no way I was going to try to put that poor injured toe down into a boot.
Yeah.
But yeah, it's rough and it's very, very painful. And I was already late to come here, and I was like, just wrap it up with Band-Aids and we'll worry about it tonight. So it's not good.
Good luck.
Thanks.
Yeah.
I am so excited this building's getting put up today. It's a little addition to the side of our riding arena, and we're going to be able to store a lot of important things under here, like sawdust and just equipment, things that need to be out of the weather. Now, it is an ex-Amish crew that's putting it up, and they are very family orientated, so they bring their kids with them to work, which is really fun. But if you see some kids that looks like they're in danger, don't worry about it. This is what they do every day of the week, in and out. It's just how they live their life. And I think it's really great that families are able to work together.
What's happening?
John's gonna join me.
Oh.
We are going to the Big Lick protest, and this is our Big Lick. They look intimidating. Just kidding. We're about to go to the Big Lick protest. We're gonna be boycotting animal cruelty. We get to see a lot of the horses that come in after they've been through Big Lick, and to me it's just disgusting to see how broken down these animals are, so I'm hoping that we can make a difference today.
A lot of people are going. Hi.
Hi.
How you feel?
I'm excited.
All right.
I feel painful.
Mm-hmm.
I'm half thinking that I should have had just my toenail removed by a doctor this morning. So every time I step it, I think it's like, oh, it's rough, but I'll get through today, and then maybe tomorrow I'll see the doctor if it's still like dangling there.
Oh gosh. Well, be careful.
Yeah.
Yeah. Don't rip it off while you're there.
I don't know how many Band-Aids I put on it. Like, I was just like bandage, Tylenol, let's get to work. So,
right.
Yeah.
Okay.
It happened after the auction, so I've got a whole month to heal for the next one.
Oh no. All right. See ya.
See ya.
How is it being the adoption specialist today?
You know, it's a lot of hard work being medical. A medical evaluator today, /trainer, /adoption specialist. Yep.
Why do you have all these jobs today?
So most of our team today actually went to a Big Lick protest, which is awesome. But we wanted to ensure that we could still facilitate adoptions today here at our facility. So today I am helping also do adoption appointments with Owen.
So this is Judge. He was an owner surrender that we got in about 2 months ago, and he is super sweet. And he's just ready for his new home.
So with Judge, he's got arthritis, we think in the hocks. We have not done radiographs yet on him. Okay. Whoever does adopt him, I would recommend taking him to a vet right away just to get radiographs, see exactly what's going on. Sometimes older horses can do great on like just daily pain meds for the arthritis or joint self-meds or something like that. So that would be something to talk with a vet. From what we've seen, he is sound at a walk and a trot. He is sore at a lope on his right hind. So he would not be one to go take running through the field or barrel racing, but just happy walking. Yes. But I'll let Sailor introduce you to him, but he is a very sweet boy.
All right. Am I doing this or are you doing this?
I can ride him first if that makes you more comfortable, or you can ride him first. It's just whatever you decide to choose to.
I'm perfectly fine with whatever. I'm a rider.
You're reaching for the helmet, so I'm assuming that you want to ride it.
I'm not scared of it at all, you know. I put the bun in my head.
So I talked with CJ, who, just to get clarification on the adoption process. So since he has like some medical issues and stuff, what we're recommending is if you do want him, because you can't take him today since we don't have a trailer. So put the $150 hold on him. That will go towards his adoption fee. And then all we ask is that you schedule his vet appointment and his farrier appointment. And just so that way we can confirm that that's there for him to go to. And then once that's confirmed, then we can go ahead and have you schedule a pickup.
Oh my goodness, you're such a good boy. I know you are.
This is, like I said, a farrier that is new to the area, but he is phenomenal. He's actually been out here a couple of times. And then just for when you call your vet to kind of talk about his care, he's just blind in the right eye. Does have the current corneal ulcer that's being treated, and then suspect hind end arthritis, have not done radiographs yet. Currently sound at the walk and the trot, just off in the right rear at a canter. So you can kind of talk with them what that would look like to kind of further diagnose and manage and stuff.
Absolutely. Thank you. Yes, we'll get in touch. We'll get in touch. Well, we'll have to be in touch, or I have 7 days to pick another one. And I mean, deadlines are great, right?
She does everybody. It's fine. She can't help it. That's what she chose to do. For us, she can help it. But that's what she chose to. She just gets to be behind the camera going, everyone else gets to be nervous and nobody can see me. And she's beautiful. She should be on camera. Thank you, guys.
Thank you.
Bye.
We're here at the Tennessee Library protesting against the Big Lick Tennessee walking horse being on the wall. On behalf of the citizens of the state of Tennessee, we're asking that it be removed. We're offended by the Big Lick Tennessee walking horse being placed very back here, hidden out on the wall as a state symbol of the state of Tennessee. The Big Lick is animal cruelty.
We're at Shelbyville, Tennessee, and we are here protesting the Big Lick animal abuse. It's really, really sad that the only way this Big Lick is achieved is through abuse. And you can tell the horses are basically tortured to do this artificial gait. And I am sitting down because I really hurt my toe this morning, but I'm still out here. I will rest tomorrow, but not today.
Big Lick, big lie, big lick, big lie, big lick, big lie. Big lick is abuse. Big lick is abuse. Big lick is abuse. So every year it gets a little smaller, it seems like. You celebrate every victory you can get, and this year seems like it's really small. I don't know if they rearranged their show schedule so they don't have their popular shows tonight or what, but there's hardly anyone coming compared to a normal year. And that is great. That's absolutely wonderful. Nobody should be coming to spectate at this event. The only reason you should be coming in here is to document and protest.
If you look into my eyes, when our time down here is spent, it's in every single line. Hope you know it was you that I loved until the end.
I'm thankful that we were able to do so much today. We got it on Fox News, and I really just want to go and put my poor injured foot up and get some rest. I had to cut my tennis shoe, so because the pressure was just killing me. But I got through today.
Ooh.